I'm Dr. Fred Coleman, a psychiatrist in Madison. I work in a variety of clinical projects involving refugees from different communities, people with severe mental illness, people from religious communities, and have a great interest in cross-cultural and international psychiatry.
I'm known as Dr. Sebastian. Full name is Sebastian Ssempijja. I am a psychologist by training, located in Milwaukee, Wisconsin. I am a practicing psychologist, but also an administrator running Sebastian Family Psychology Practice. This exchange is important as part of global health and global mental health, on the pretext of looking at the necessity to understand issues affecting global health, but in particular on mental health in a very unique way. That the issues that we here in Wisconsin, in Madison in particular, but also for that matter in Milwaukee, the diverse population that Dr. Coleman has mentioned, and the ones we serve in Milwaukee, that include our U.S.-born clientele, but also an increasingly diverse immigrant and U.S.-born diverse population, really necessitates a larger discussion to look at how other regions of the world are experiencing challenges of mental health, behavioral health, addiction, and the cross-section with the general health and wellness. And so we want to do that within the prism of the Mental Health Action Plan, which is a plan that was developed and adopted by the WHO in 2013, and will be reviewed in 2020, maybe even 2025. And within that Mental Health Action Plan, there's a call for action on the engagement of local entities along with international entities working together. So Wisconsin and the partnership we are creating is really stepping forward to advance that dialogue and bring it to a different level. In addition to the work that we're both pleased to see, to have the support and the involvement of Dr. Coleman here to strengthen the work you're doing in East Africa. So
one of the very important aspects of this is that an everyday viewer here in the United States may only think of this as if there were skills, abilities, knowledge to be exported. But through the kind invitation of Dr. Sebastian for the last 3-4 years being involved in the East African projects, I've learned a great deal that we need to know. And so bringing the collective here is giving us a chance to expose people throughout the mental health care system here in Madison to learnings that will improve what we do. Just one example. We're hearing from people who, facing scarcer resources than we have, are being creative and innovative about new and more effective ways of providing mental health care. We complain about the increasing cost here, but if we're more effective and more clear about the best ways to do it, costs will come down, something dear to the heart of every American consumer.
I would like to address the challenges, but let me start with the opportunities that are over the course of time, over 30 years that I've served in the Milwaukee metro area, and in my different roles. The communities that I serve are really under stress and underserved in very many ways. But where I'm seeing opportunities in serving these communities, one is what I've noticed over the last 3 decades is a willingness to seek out mental health services. Family members willing to refer and support their loved ones. The engagement we have now in the schools within MPS to work in the schools and deliver school-based mental health services. The collaboration between prescribers, psychiatrists, psychologists, counselors, and parents working together to manage medications, which used to be very huge barriers before. Now we're seeing more cooperation and engagement with the HMOs and other third-party players coming up, programs like Wraparound, like CCS, Comprehensive Community Services. I'm seeing all those as more opportunities towards serving. Now the challenges are also there. The challenges include, of course, the effects of economic poverty, pressures on social isolation, which make coping with mental health issues much more difficult, for challenges on employment, especially when you're looking at the low-end, low-income people, folks struggling with mental health challenges which may interfere with their incomes, and finding that those incomes are interrupted, which then affects things like that are essential, like housing, transportation, food. Those challenges are there. For our refugee immigrant populations, we have, of course, the issue of language and translation. We have issues of adjustment, which may also include dealing with the pressures of getting and keeping jobs, job advancement from low-income jobs to higher jobs. And so those are challenges that are in a way not unsimilar to our mainstream populations.
One of the really important concerns here is people who don't receive the same services as others. One example of this is the 50% of Americans who live with not $400 that they could meet a crisis with. And a major mental health issue in a family is a crisis and can lead to loss of job, loss of home, loss of the ability to enter back into major parts of society. Major mental illnesses strike everyone, regardless of income, and the most severe illnesses have the least access to treatment. And finally, two crises in the newspaper often are the opiate crisis and the problem of jails and prisons. Both overlap the areas of mental illness, and part of the difficulty of really addressing either of these is not having an integrated approach to trauma, substance use, and mental illness. Over the past 3 or 4 years, I've been going to Uganda at the invitation of Dr. Sebastian. But one of the beginnings of this was my speaking with Laurie DePreet Brown of the Global Health Institute about a summer quality improvement leadership institute, and are bringing a team here from Uganda to first make this connection. The follow-up in our conferences there has led to increasing interest across the Rift Valley or East Africa, so that all of the participants here said, if it's being sponsored by the Global Health Institute, this is going to be a thing of major quality, which will lead to change in our countries, and we want to bring our teachings to you under this sponsorship.
So for me as a private practitioner and partnering in Milwaukee, I found it a great pleasure to look at what the Global Health Institute and its QI component have allowed us to ask the right questions and get the right guidance on improving quality of delivering mental health within our parameters locally here in Milwaukee and also in Wisconsin. We are also fortunate that Dr. Coleman has been collaborating as a consultant, as a colleague with our clinic for over 15 years. So he knows our clinic's culture, he knows our clientele, and now with him coming to Uganda 3 times in a row, working with our Ugandan and East African partners, we are able to implement these principles with our partners in East Africa. In fact, in 2017, we had our Ugandan partners participate in this training, which then made it possible to have now this involvement. Now we have Dr. Hafsa, we have Dr. Bashir, and now Dr. Tunde from Nigeria, in Ethiopia, and also Uganda coming in as part of the scaling up of that relationship we have with GHI, and we are so grateful for that.
One of the catchphrases we're using, because it captures so much, is mental health is public health. and public health is mental health. Public health talks about the whole population, everyone, being healthier when health issues are dealt with by early intervention, by prevention, and by good treatment. And this really captures the essence of what we're about.
In addition to what Dr. Coleman is so well capitalizing, the Federation on Mental Health Associations, if I'm not wrong on that name, they have this statement, there's no health without mental health. And in fact, there's no mental health without good health. So when you're looking at expanding that component and also adding, the quality of delivering services and sustaining them becomes so crucial. Our country, United States, is still struggling with stigma towards mental health and addiction. And God knows what a crisis we are in now in our state and in our nation, especially now with the opiate crisis. But the entire world is beset and concerned about the quality of substance use and abuse and the quality of mental health, both at the clinical component, but also on areas that improve overall health. So having this discussion really not only makes mental health and mental wellness to bring it into the mainstream, but to extend it into our different life domains, from families working and getting along together to communities growing very well together, mental health in the workplace, mental health in the schools, mental health in our government. God knows that discussion is far from over and should be at each person's kitchen table.